The Ministry of Health is expanding its immunization coverage throughout the country. Today, health officials introduced 2 new vaccines into the system focused on preventing diseases which could cause pneumonia and the chickenpox. Health Minister Dr. Hubert Minnis talked about the program's aim.
The new vaccines that we're introducing, the pneumococcus vaccine, which would help to prevent the problems that we see with children in terms of pneumonia or meningitis and other types of infections. And then the chickenpox vaccine. As you know, vaccination is the best method to prevent illnesses, and therefore it's essential that we stay in the forefront and have maintained the over 90% vaccination rate. That is extremely important in terms of prevention, especially to Bahamas, where our main industry is tourism, and 60% of our GDP come from tourism, where 70–75% of our employment, be it directly or indirectly related to tourism. It's essential that we maintain a preventative program so as to minimize the possibility of disease being introduced.
Now, Deputy Chief Medical Officer Dr. Daylon Brennan says while the vaccines are here in the country, they will not be introduced to the public until January.
The form itself will give them both the science behind it and also the activities we want going forward. Each of those providers will then be educated to be able to pass it on not only to other healthcare providers, but also to the general public. So each of the patients they see or the parents that they're involved with, they'll be able to have an educated discussion with them regarding why we want to do the vaccines that we're doing and the benefits of the vaccine and how those will be beneficial to each of the patients and the general public. We'll also give them some information on what side effects you can have and those people who are able to get the vaccine and who may not be able to get the vaccine. Truthfully, most vaccines are available and will cause most people not to have an issue. It is very rare for you ever to have a vaccine-related reaction, but we do want to inform people as to the small group of the population that may have problems with the vaccine.